Ladies, it will be your top 5 health screenings, all right? And I've got a little bonus for you all too. So drop in the chat where you're from. Drop any questions you have about primary care and medical weight loss. If you're in the Las Vegas area and you're looking for 5-star quality concierge style care, we would love to care for you here at Inspire Primary Care. We are taking care of individuals, families, and businesses. So if you are a business owner with employees, we would love to keep your whole team healthy and provide quality health care to your whole team at a very affordable rate and save your business money while providing high quality care to your employees. So reach out to us to learn more about that as well. All right, so here we go. Our top 5 health screenings to know. Let's do our little health checkup. You ready? First thing that we should be getting screened for, this one is for the ladies. Number 1 is going to be our pap smears. Ladies, are you up to date on your pap smear? So if you are over 21 years old, pap smears are screening for cervical cancer. Pap smears, say this with me, pap smears are screening for cervical cancer. It is not screening for sexually transmitted as a pelvic exam. Pap smears screen for cervical cancer. So this is a screening that should be done for all women starting at the age of 21. Now, how often we do these, all right? As I give you these screenings and this health checkup, I want you to know that I'm giving you a blanket generalized recommendation for most adults. However, this is where having your own personal physician comes in. You need your own primary care physician because everything should be tailored to the individual, because you have your own health history, you have your own risk factors, you have your own personal family medical history, surgical medical history. There are other things that may be contributing that may shift some of these guidelines for you as an individual. But in general, women over 21 should start getting pap smears. Now, how often this should be done? This, again, is where people get very confused because there is something called guideline recommendations where the different medical societies have created guidelines around how often these should be done for people. Again, a blanket recommendation based on our evidence-based research and clinical trials over the years. However, there is also clinical recommendations where your personal physician may, based on their clinical practice and their individual training, may recommend a slight difference in how often they believe these should be done. And these are patient-physician communication discussions that should be had as an individual. All right, but let's go back to the blanket recommendation. Guidelines say that a pap smear should be done every 3 to 5 years. If you're under 30, we don't screen with HPV, so that should be done every 3 years. Once you're over 30, we screen with HPV. And then if that's normal, by guideline standard, you could wait every 5 years to get your next pap smear. Now, clinical guidelines, I still recommend for my patients, okay, for our members here at Inspire Primary Care, I do recommend annual, once a year pap smear screenings because every so often, very rare, but it does still happen. If you wait that 5 years, a cancer can develop and it can be in a later stage. And in my opinion, my medical opinion, my clinical opinion, why wait when this is a very slightly uncomfortable exam, but it could save you from cancer. So it's something I recommend for our members to get done once a year, but you will hear people say that you can wait 3 to 5 years to get that done. All right. But once you're over 21, ladies, this is a preventable cancer, cervical cancer screening. All right, drop any questions you have. We're going on to number 2. So the number 2 top health screenings that we should be getting done as adults is going to be that mammogram. So ladies, are you up to date on, first of all, ladies, are you up to date on your cervical cancer screening, that pap smear? Have you got it done in the last year or the last 3 to 5 if it's normal and you're going based on guidelines? And ladies, are you up to date on your mammograms? Gentlemen, hold tight. Your guidelines are coming up next. The first 2 are for the ladies, okay? So ladies, are you up to date on your breast cancer screening with the mammogram, okay? So that, again, guidelines say that you can wait until 50 years old to start screening for breast cancer through a mammogram. I recommend starting to have that patient-physician discussion around 40 years old. So 40 to 50, I'm going to decide with my patient when we want to start screening based on other risk factors they may have. That's a whole nother discussion. And based on any symptoms they have. So it can be started earlier. Again, I start having that discussion around 40 years old with my members on when we want to start that screening. But guidelines say to start the screening at 50 years old, all right? And that is a mammogram. Now, how often should you get the mammogram done? That should be getting done Guidelines say every 1 to 2 years, so you can wait up to 2 years. But I, again, clinically recommend for my members to get that mammogram done every year, once a year. All right. So let me know if you have any questions. Again, talk to your doctor, see when the recommendation is for you based on your own personal health history. But these are general guidelines just so we're familiar with these health screening guidelines. All right, here we go. Number three on our health checkup list. So ladies, are you up to date on your pap smear? Are you up to date on your mammogram? If you're in the Las Vegas area and you need quality primary care, we'd love to care for you at Inspire Primary Care. All right, number 3, gentlemen, here's where you come in the picture. All right. So the number 3 health screening that we should all be getting as adults is going to be colon cancer screening. I was going to say a colonoscopy, but let me just start with colon cancer screening. So guidelines say that colon cancer screening, again, blanket recommendations. If you don't have increased risk factors, that's a whole nother discussion on what those risk factors are. We can come back another time and talk about those if you have questions on that. But a generalized recommendation for when colon cancer screening should start is 45 years old. 45 years old. Guidelines used to be that we started colon cancer screening at 50 years old, but we were missing too many cancers between the ages of 45 and 50. So the societies have officially made the recommendation to start colon cancer screening at 45. So if you are 45 or older, are you up to date on your colon cancer screening? Now, the question is, should I get a colonoscopy versus doing something like Cologuard? I can do a whole separate video on colon cancer screening if you all have a question. I recommend the most accurate of them, which is going to be a colonoscopy for my members, unless they just flat out tell me I will not get a colonoscopy. Then we talk about, if they are a low risk patient, then we talk about other options like Cologuard, okay? But best recommendation, gold standard recommendation is going to be colonoscopy starting at 45 years old, maybe earlier depending on if you have a first degree relative that had colon cancer, if you were a tobacco user or if you were a heavy alcohol user, then those may be things that shift the recommendations younger. Or some other things like blood in the stool, history. But otherwise, 45 years old, start getting those colonoscopies. Now, the question is going to be, well, how often do I have to get a colonoscopy? If your GI specialist, once you get a colonoscopy done, your GI specialist will let you know how often you need to get it done again, or the next frequency based on your results. But the general guidelines is if the colonoscopy was completely normal, it is typically a every 10-year test. So once a decade if it's completely normal. All right. So if you're over 45 years old and you're watching this, are you up to date on your colon cancer screening? Are you up to date on your colonoscopy? All right. We're headed to number 4. For our health checkup. Those who have joined, drop in the chat, where are you joining from? And if you have any questions about primary care or medical weight loss services, let me know. I will answer your questions. We're going through our health checkup and we're on number 4 of 5. All right. So number 4 health screening that all adults should be getting is going to be lab work. Okay. So I had a comment recently. I did a reel on our socials about lab work. And one of the comments said, oh, I didn't realize that if I'm a healthy adult that I still needed to be getting blood work done. So this is very important to know that for your health screening, if you are an adult, you should be getting lab work completed at least annually, at least once a year. That is my recommendation to my adult members. Why is that? Because we're screening for health concerns. If you don't look until you have symptoms, then we may be having to treat something with pills without, basically you're too far down the line for something we could have prevented. So I like to look at health in the different areas of health and like a green light, yellow light, red light. So us screening annually in our adults, especially with things like labs and the next component we'll talk about, lets us catch things and helps to increase the likelihood that we'll catch health concerns when it's in that green or yellow light zone. So we can transition the yellow light back to green light. Okay, versus us waiting until you feel really, really bad and then you get lab work done. This has been going on for years, whatever it may be, diabetes, for example, and then we get your hemoglobin A1C done and it's so high that the only thing we can do to safely protect your organs is start treating with medications. So if you really want a wellness-focused approach to your healthcare, which we should want that, then getting these screenings done before you start having symptoms And especially when diagnoses have happened, but especially when you feel healthy or believe you're healthy, getting these screenings done regularly so we can catch things early and make some shifts in your health early is going to be the best recommendation. We don't want you to start seeing a doctor and getting established with a primary care physician when your health is in the red light zone. Does that make sense? All right. So if you are a healthy person, yes, you still need a primary care physician. You should still be established with a quality primary care physician that knows you and can help you stay in that green light zone. And if you're in that yellow light zone, can help you, that has a preventative training and can help you reverse into the green light zone. And that's what we do here at Inspire Primary Care. So are you up to date on your annual lab work? Some of you may be thinking, well, what should I be getting done annually? Again, some of these labs may be added, additional labs may be added on depending on what symptoms you may be having, other health risks. But in general, the things I like to get done for my adult members each year is going to be, again, I can do a separate video on breaking down what these mean and what these look for. But just to give this to you so you can write them down, is going to be a CBC. A CBC, a complete blood cell count, a CMP, a complete metabolic panel, a TSH, T4, a hemoglobin A1C, a lipid panel, and an HIV on any sexually active adult. So those are my 6 that I like to get done for all adults, plus adding any additional if they're having any additional symptoms like plus or minus iron panels, plus or minus vitamin D, vitamin B12, etc. All right. So I hope that answers that question of, if I'm healthy, do I need labs? Yes. Get your lab work done at least once a year. And if those are abnormal, then your physician may recommend for you to get them followed up on, more frequently than a year. All right. I see new people joining. Drop in the chat. Where are you joining from? And we are on part 5 of 5 of our health checkup. So are you up to date, y'all, on your labs? Don't be lying. Are you up to date on your labs? Once a year, we should be getting those done at minimum. All right, and here we go. Last things. I can't skip this. I love this. It's what people don't want to talk about, but we've got to talk about it. The 5th part of your health screening that all adults should be getting done at least once a year are vital sign screening. Vital sign screening. Now, the vital signs look at several different aspects of health, but there are 2 vital signs in particular that I want to know. Are you up to date on this screening? Are you ready? Are you up to date on your vital sign that looks specifically at your blood pressure? So have you had your blood pressure checked in the last year? Have you had your blood pressure checked in the last 6 months? Have you had your blood pressure checked in the last quarter, in the last 3 months? This is information that we want to know, what our blood pressure typically ranges in, what our systolic, that top number, what it typically is, that diastolic bottom number, what it typically is. We want to know if we're in a healthy blood pressure range regularly. Do you know what that is? Do you know what that number typically is for you? So important. Uncontrolled or unknown hypertension or high blood pressure is one of the top reasons for sudden death from stroke and heart attack. This is preventable if we're able to screen and catch these things early, okay? And then lastly is your weight range. All right, nobody wants to talk about the weight. People don't like to get on the scale when they're at the primary care office. However, it is so important what our weight is and if it's a healthy weight for our frame. We're not just talking about BMI, plugging the height and the weight on a chart and saying, are you overweight or obese? That's not necessarily how we do it here at Inspire Primary Care at our wellness focused practice. We're looking at a whole person approach, but we know typically what our healthy weight range is, what the weight range that feels healthy on our frame, in addition to being healthy metabolically, right? Having healthy labs, healthy blood pressure, in addition to feeling good on our frame. That is what we call here at our practice the healthy weight range. Are we in our healthy weight range? We don't want to talk about it, but we need to talk about it. It's one of the most common causes of almost all of the chronic diseases is having a weight outside of our healthy weight range. So those are the 2 vital signs I want you to be up to date on knowing for yourself is your blood pressure and your weight, and if you're in the healthy weight range. And you want that done at least annually, but let's be honest, we should be more familiar with that more frequently. At least quarterly, we should be kind of just checking in on these things to know where we're at. All right, y'all. Where are you with your health checkup? Ladies, are you up to date on your pap smears? Are you up to date on your mammograms? Gentlemen and ladies, are you up to date on your colonoscopy? Are you up to date on your labs? And are you up to date on knowing what your vital signs are, particularly your blood pressure and your weight? All right, that's what I got for you. write those down. Be honest with yourself. If you are in the Las Vegas area and you're like, I am not up to date on these things, I didn't really know I needed to be up to date on these things, I haven't really been having symptoms, or I've been avoiding it, I've been scared to go to the doctor. I've had a lot of new members join and tell me that they've been looking at our social media for a while and they have just been scared to go to the doctor. They've been scared to find out something or find out bad news, or they've just been avoiding it, or it's been on their checklist and they've just been like, maybe next month, maybe after the summer, maybe before the new year. If that is you and you are not up to date on your health checkup and you're in the Las Vegas area, you have zero excuse. There is high quality concierge style care right here for you, where your personal physician is a text and email away, where you have easy appointment access, where you're not rushed. Your visits are 30 to 60 minutes. It is amazing. And once you experience it, it's no going back to the wait and the hassle of the insurance-based doctor's office, and we'd love to care for you. So if you're not up to date on these health screenings, and you don't have a quality primary care physician, and you're in the Las Vegas area, we would love to care for you at Inspire Primary Care. You just go to our website, inspireprimarycare.com, no I in front of Inspire. Click the enroll button shaped like the Las Vegas sign, and we will see you soon and get you up to date on all of these things. If you're in Las Vegas and you're like, I need to get established with a quality doctor, look into other types of direct primary care or membership medical practices to see if there is this type of quality care near you. But all adults should be established with a primary care physician that is wellness focused, that has time to really care for you. And we want to be getting these screenings, even if we think we're healthy and don't have symptoms, and especially if we're avoiding it because we don't want to hear any bad news. All right. So I'm not seeing any questions in the chat. I will check the replays, so feel free to let me know where you're joining from. Feel free to let me know if you have any primary care or medical weight loss questions, or questions about any of these type of health screenings you'd like me to go more in depth on. I would be happy to come back and do additional lives and more content around your questions. And thanks so much for being here today. And I'll see you on the next one, all right? So have a great day. I'll see you next time. Bye.